Hello, my name is Katie Courtney, and this is my Empowerment Week 1 activity assignment. In this PowerPoint, I will discuss the significance of evidence-based nursing practice, obligation of the nurse leader, F&P, or educator in leading change, establishing an evidence-based culture, and the reference I used to come up with this PowerPoint. There are so many reasons why evidence-based nursing practice is important. I have highlighted the points I believe to be most significant. Higher quality patient care and satisfaction can be achieved, which leads to better patient outcomes. Due to research, patients are becoming bigger parts of determining their own care and the needed advancements to nursing practice. Instead of staying with the technology in place because it's what we always used, the patient can tell us what can improve their quality of care. And then using evidence-based nursing practice, we can develop a solution. Research then gives us the reason as to why we are doing these new practices, and it creates a better understanding before implementation. With continued education and research, nurses are able to make informed decisions about patient care. Obligation of the nurse leader, F&P, or educator in leading change. Unfortunately, our change leaders have been pulled away from the clinical aspect to focus on managerial tasks. We need to return the main focus to clinical in order to see greater changes for patient care improving. Setting standards for care and goals for staff nurses to achieve will reward our staff nurses and motivate them. Our leaders need to be role models and see that these changes are able to happen and can integrate into workflow easily. There also need to be open communication so that staff nurses can have guidance if they have questions about these new evidence-based practices coming in. Our leaders need to include the staff. If changes are being made without any discussion, staff nurses are less likely to complete these new tasks, as they feel that they're overloaded with their heavy workloads. Establishing an evidence-based culture. In order to have evidence-based practice come in, there needs to be the culture and the environment. This has to have open access to resources, continued education that's promoted and encouraged, support from the leadership, and collective clinical decision making. So as discussed prior in the last slide, I talked about how clinical leaders need to include staff nurses while making decisions. This also reflects on their culture. If staff nurses feel that managerials are pushing down on them a bunch of tasks that are just overloading them, they're going to be exhausted and they're not going to be able to complete these new tasks that are going to better patient care. With open communication, managers and staff nurses can come up with a solution on how they can slowly integrate these new changes. All together now. When putting together the significance of evidence-based nursing practice, the obligation of the nurse leader, F&P, or educator in leading change, and establishing an evidence-based culture, you get three main components: individual, environment, and organizational. The individual are your staff nurses. These are the ones enacting your changes, putting it in, and bettering patient care. Then you have the environment in which they work. This also needs to have a lot of attention focused on it. It needs to make sure that these nurses are not getting overwhelmed and that they can easily integrate these evidence-based changes into their workflow. After the environment, you have the next level, which is your organizational. These need to be supporting education and research and allowing the nurses to have the time to enact these changes. Overall, all of this together is the prioritization of patients' needs. It's making a better outcome and stay for the patients so that they can receive the best quality they can with the advancing technology that we have. This PowerPoint was based off of my own insights and the article, Setting the Climate for Evidence-Based Nursing Practice, What is the Leader's Role? I hope you enjoyed.